Hi, my name is Stephanie Lee. My project is the needs of a special population, HHT patients in America. So I'm going to start by introducing the disorder that this presentation will focus on to give you a little background information. Hereditary hemorrhagic telangiectasia, or HHT, is a genetic disorder of the blood vessels. It affects males and females from all racial and ethnic groups, so there is no discrimination on who is affected. The disorder is also referred to as Osler-Weber-Rendu, named after the doctors who studied HHT about 100 years ago. Well, a century later, HHT is often misdiagnosed still in affected individuals, and many doctors do not understand all of its manifestations. The estimated time of suffering before diagnosis is 30 years. HHT can be recognized in individuals with three specific criteria. First being epitaxies, which are nosebleeds. Second, telangiectasias, which are red bumps on the skin that sometimes bleed. And third, family history. But the disease is more difficult to diagnose in many patients. Some may not experience physical characteristics of HHT that can be seen without medical testing. Serious consequences, even death, may result if blood vessel malformations in the lungs, liver, or brain are unrecognized and left untreated. As an example, a malformed blood vessel in the brain can easily cause a stroke for an HHT patient. This disorder is fully treatable, however, as long as routine surveillance is done, which therein lies the problem. By the way, those are my daughters from a couple of years ago in the picture at a fundraising walk for HHT that we were at. So next I want to go over the population description. It is estimated that 1 in 5,000 people have HHT in the United States, which is quite high. To put that into perspective, ALS, or Lou Gehrig's disease, if you recall from the Ice Bucket Challenge, only affects 1 in 100,000, and this is 1 in 5,000. So HHT has a very high incidence rate, but it is not very prevalent because 90% of those with the disorder go undiagnosed. It's not a disorder that people talk about, and very few physicians are trained to recognize and diagnose it. This disease is genetic, hence the first H in the disease name. So it is a disorder that is chronic and lifelong that needs constant surveillance. As stated in the previous slide, most people go to numerous doctors for decades to treat their symptoms without ever having an answer as to what is actually wrong with them. This specific population of individuals struggle for many reasons that we will cover in this presentation. The chart in this slide shows the diagnostic time lag in various rare diseases. Some you may recognize, such as cystic fibrosis, labeled as CF, or Crohn's disease with the CRD. And you see that HHT has the second longest to diagnose out of all of them. Okay, so now let's look at the biggest predisposing characteristic to this specific population of individuals. As I stated earlier, race and ethnicity do not play a role here, either do gender or age. But what is influencing this group to be segregated is the geographic location of medical centers that treat HHT. As you see in the picture, there are very few established HHT centers in the United States who know how to handle this disorder. An HHT Center of Excellence is defined as a medical practice within a hospital that provides comprehensive coordination of care necessary for treating HHT patients. They proactively manage the care of patients with an integrated team of experts. This includes ENTs, pulmonologists, neurologists, and hematologists, just to name a few that HHT patients have to see, because this disease affects the entire body. This makes the population of individuals who have HHT extremely vulnerable when it comes to diagnosis, surveillance, and treatment. If they do not have access to care due to their location, they will have an inferior health status compared to those that do live close to an HHT center. On a side note, UF Shands is actually expected to become the next Center of Excellence within the next 5 years, thanks to some great HHT research that is being done here currently. So looking now at the enabling characteristics for this special population, we're going to focus on insurance status. We know that the uninsured are generally in poorer health than the general population and use fewer health services than the insured. But the population of HHT patients in particular suffers even more. This is because even those who do have insurance can be stopped from getting the needed appointments, tests, screenings, and procedures done for HHT. Let's take Medicaid for an example. So if an individual lives in a state that has a center of excellence, it is not as hard to get approval for the patient to be seen by these specialists, but it still takes much finagling because getting prior authorization from insurance companies for treating rare diseases is a battle in itself. But what about those Medicaid patients who live out of state? Medicaid, although a federal insurance, is state mandated. It is extremely difficult to get a state to cover out-of-state referrals. Medicaid's rule states that the state itself has to determine on the basis of medical advice that the needed medical services or necessary supplementary resources are more readily available in the other state. This process is relentless and can take an upward of 12 months to be finalized. This is devastating for patients with HHT who need lifelong screenings and treatments to manage their health. Looking at the picture, you can see most states there are in gray. They have no legislative action for state-to-state coverage. 3 of those states have enacted a cross-state law pre-Affordable Care Act, and 2 have post-Affordable Care Act. Many others did not pass or were vetoed altogether. So this is a public health concern for special populations with specific medical needs. A need characteristic of vulnerability in patients with HHT is definitely because this is a chronic illness that usually worsens with age. It can disable many people from working, actually. Those people who cannot seek treatment, either because they haven't been properly diagnosed, can't afford to see specialists, or live a long distance away from a treatment center, face extreme barriers. It's hard to keep a job when your nose is bleeding for an hour at a time, or people are so weak from anemia that they physically can't go to work and don't know why. The problem is that HHT is not easily categorized as a disability because activities of daily living and instrumental activities of daily living are not compromised. With chronic illness being the leading cause of death in the United States, this certainly makes this group vulnerable to a very decreased quality of life. Looking at some statistics regarding my special population of individuals who have hereditary hemorrhagic telangiectasia, we know that each child born to a parent who has HHT has a 50% chance of inheriting the disorder. Babies are not born with physically visible signs of HHT, so genetic testing is used. So what about those families who lack insurance plans that cover the cost of expensive genetic tests, or those that are already struggling financially and now have to worry about routine surveillance not only on themselves but their child? Now, symptoms can be mild to severe, some even asymptomatic, but everyone has a different level of symptom severity, and screening is the same regardless. With 90% of people going undiagnosed, HHT can be said to be medically underserved. So what does this specific population do once they have been diagnosed or suspected to have HHT? Many people may not know where to look for a doctor, a treatment center, or how to talk to their insurance company about getting coverage. Luckily, there is an HHT Foundation that was established to help people get the information they need. Doctor lists, pre-written insurance letters, and patient liaisons are just a few of the benefits this foundation has to offer to the vulnerable population. There are even free webinars on medical education to help the patient take control of their disorder, and national conferences for doctors to attend to keep them up to date on research. From a needs assessment perspective, this is quite a valuable resource for patients to use at no cost to them. So now where do we go from here? We have an established special population. We know there are cost, access, and quality issues for individuals who have the disorder, and we see from the vulnerability framework that there is a likelihood of experiencing poor health outcomes for this group. Awareness and advocacy, especially to medical professionals, would benefit patient outcomes. Perhaps conducting an assessment on physician knowledge of HHT to determine why so many people are being misdiagnosed can be a huge step in knowing where to go next for the betterment of this population. Well, I really appreciate you listening to my movie, and hopefully you learned a little something about HHT outside of the class. So here's some questions for you. Number 1, what additional reasons exist that explain the extreme percentage of patients being misdiagnosed? Number 2, what measures could be taken to improve access to care in areas without HHT centers of excellence? And number 3, as a critical thinker in healthcare, what additional factors would you consider to be valuable in your needs assessment for this special population? Thanks so much.